And so I'm actually going to pass over the microphone to her to give you a brief summary on the situation. And then that will be followed by the mayor, and Leo will then, after that, moderate and take questions from media.
Yeah. So we're just going to pause for 2 seconds because we're waiting for Dr. Liu's slide deck to be uploaded to the screen. So we'll just be like 2 seconds, and as soon as it's uploaded, we will start the conversation. Dr. Sprit jumped the gun.
Yeah, that's perfect. Yeah, that'd be great. Thank you.
Good morning, everyone. Firstly, I want to thank all of you, the media professionals in this room, for your tireless work these past few days. There has been so much information that our community members need to know, and you have played a critical role in getting important, credible information to them quickly and accurately. So thank you to all of you in this room and on the teleconference line, and to your colleagues. As you know, yesterday evening, Algoma Public Health confirmed the first Algoma citizen, a returning traveler from the US, to test positive for COVID-19. Given the global transmission of this virus, this was not unexpected. And in fact, over the past few weeks, Algoma Public Health has been working closely with our hospitals, healthcare professionals, first responders, long-term care facilities, school boards, post-secondary institutions, and especially our 21 Algoma municipalities, including the city of Sault Ste. Marie, all to prepare for COVID-19. I want to emphasize that all the appropriate precautions were taken when this individual returned to Canada in the late evening of March 15th. This individual had developed symptoms, and so they stayed at home and contacted Algoma Public Health on Monday, March 16th. Public health nurses worked with local paramedics and with Sault Area Hospital to safely transport this person to the hospital for testing and safely transport her home again. This individual continues to recover at home at this time. As a precaution, we are asking that any Algoma resident who flew on Delta 4212 into Chippewa County International Airport on March 15th at approximately 10:45 p.m. to contact Algoma Public Health. These flight passengers, along with any other returning traveler from abroad, should be self-isolating at home for 14 days, as recommended recently by Canada's Chief Public Health Officer. So, what does this mean for Algoma communities? Firstly, it's important to remember that in this case, exposure to the virus happened abroad and not within our local community. At this time, we do not see evidence of local transmission of the COVID-19 virus in Algoma communities. This does not mean that we can be complacent. The virus may start spreading more widely, and we may start to see community spread. Because of this, now more than ever, we are asking all Algoma citizens to help prevent the spread of the virus, especially through the use of social distancing measures. Social distancing means doing our best to avoid close contact with people outside of our immediate families by staying a distance of 2 meters apart from one another. It means staying home if you're experiencing any symptoms at all, and certainly avoiding contact with people who are vulnerable, like the elderly and those with underlying medical conditions. If you are feeling well, it's still okay to go about daily activities, like going to work if you cannot work from home, and doing necessary shopping and appointments. When in public, simply avoid crowds and try to keep a distance of 2 meters or 6 feet from those around you. Social distancing does not mean shutting ourselves off from the world. We live in Northern Ontario with lots of outdoor space. If you are healthy and feeling well, you can still go outside for a walk, a run, clear the snow, do yard work, walk your dog, enjoy nature. All of these things can still be done while keeping a distance of 2 meters apart from one another. Staying active improves both physical and mental health. Being in nature and green space, which we have in abundance, is also good for mental health and coping with stress. Use technology to connect virtually with family, friends, and coworkers. Social distancing actions are a big change from what we are used to, but the more we practice doing social distancing now, the better prepared we will be should the virus start spreading locally to protect ourselves, our loved ones, and the entire community, especially those who are more vulnerable to illness. We may not have special medications for COVID-19 right now. We may not have a vaccine yet, but we do have actions that all of us can take that have already been working in other parts of the world to slow the spread of disease and flatten the curve, so to speak. Just over a week ago, I showed this epidemiologic curve, or EPI curve, to Sault Ste. Marie Council, which shows the sharp rise of COVID-19 cases in China, and then a gradual flattening of the peak as public health measures were put in place. This is what we often see when unexpected outbreaks happen. The problem with big surges of illness over a short period of time is that this can overwhelm hospitals and healthcare capacity to the point where not everyone who needs care may get it. High numbers of serious illness and deaths can happen in this scenario. Public health containment measures, social distancing measures, population behaviors can all help flatten the curve. As an example, this is what flattening the curve looks like. This is Hong Kong's experience of COVID-19. And even though Hong Kong is a hub of international trade and travel with many connections to mainland China, public health officials, along with local citizens there, were able to flatten the curve and avoid surges of illness. They used public health strategies like school closures and travel-related quarantines and widespread social distancing measures to achieve this. To find out more about social distancing and to keep up to date on the current situation in Algoma, please do visit our website at algomapublichealth.com. There is information there for the general public, as well as for community organizations across different sectors. And finally, to all the hundreds of residents and community partners who have been in touch with us in recent days, we thank you for reaching out to us for reliable, up-to-date information and for taking proactive actions to protect Algoma community members. We encourage everyone to keep up the hand washing and not touching your face and staying home when ill, and especially now, start to practice social distancing. Thank you for your vigilance and your commitment to the health of Algoma communities.
Dr. Liu. Thank you, everyone, for being here today. Yesterday, the Premier of Ontario declared a provincial emergency resulting from the international pandemic COVID-19. Yesterday afternoon, I participated in a conference call and received a briefing with Deputy Premier Elliott, Minister of Municipal Affairs and Housing Clark, and Ontario's Chief Medical Officer of Health, Dr. David Williams. Last night, Algoma Public Health confirmed the first positive test for COVID-19 in Algoma. We thought it important that we make ourselves available to share our perspective, outline preparatory work we have and are undertaking, and identify important ways that the public can assist us. We are also here to answer your questions. As we are all aware, Algoma Public Health is the lead public health agency for our community and for all of Algoma. It is our subject matter expert. The city has been working with and supporting Algoma Public Health from the outset of COVID-19. I want to recognize our Medical Officer of Health, Dr. Spruitt, and our Associate Medical Officer of Health, Dr. Liu, and the entire team here at Algoma Public Health for their professionalism and their leadership. They have been working tirelessly and around the clock. I am personally grateful for their efforts, and on behalf of City Council and the community at large, I express our deepest appreciation. I also want to recognize the team at Sioux Area Hospital, the executive, management, physicians, RNs, RPNs, and support staff who are providing critical care to our community, and while doing so, preparing for a potential surge in the demand of their services. In the same manner, we have healthcare providers across our community, from the group health center to family health teams, who are serving it capably and professionally every day, day after day. We express our gratitude to them all. We know that COVID-19 has been declared a pandemic by the World Health Organization, and our province has now declared a state of emergency. We are coming to understand and use new language and employ new concepts like self-isolation and self-distancing. Our businesses, large and small, are facing a period of unprecedented interruption, and our economy at large is subject to significant risk. This is understandably a period of uncertainty and concern for our community and for each of us. I recognize that people are worried about a lot of different things. They're worried about their health, the health of their loved ones, their jobs, their businesses, their supply of food and essential items. In the context of the information we are receiving, this anxiety is natural and it is understandable. And while we can all be rightfully concerned about the economic consequences of the pandemic responses and recognize that we will have a lot of work to do to sort through those, it is apparent that we have to stay focused in the short term on the primary goal of maintaining essential services while slowing the spread of the virus. In that respect, I can advise the municipality, including our Public Utility Commission, is focused on our ability to maintain critical services and infrastructure, and that we are fully committed to doing so. We have assessed our current staffing, our potential staffing challenges, and our business continuity planning in the context of those challenges. We have announced some closures of non-essential services, and we are examining others with the expectation that we'll be further reducing non-essential service levels. Our police chief, our fire chief, our paramedic chief, the CAO, Public Utility Commission are all focused on keeping their workforces healthy to keep our community safe. The city is working with community partners to establish an information line for people and a line for businesses so that we can better stay connected with one another, provide correct information to people who have questions, and importantly, to identify people who need additional assistance. I can also assure you that our community leaders are working together diligently and cooperatively with APH and with each other. Yesterday, healthcare professionals and local leaders participated in a Sault Ste. Marie Emergency Management Planning Committee teleconference. Organizations shared details on measures they are taking related to the COVID-19 pandemic, our common challenges, and how we can support one another. This pandemic is our foremost priority, and we will continue to communicate with one another, support one another, and work together. We will continue to listen to the advice of our public health professionals and make sure we do what we can to protect the health and safety of our community. However, and I stress that this is a very important point of today's communication, this is not a challenge that can be overcome by our local leadership and the organizations in our community alone. Everyone, each one of us has a role to play in limiting the spread of COVID-19. Every one of us has a role to play in taking care of themselves and looking out for each other. It is incredibly important to follow the guidance of public health professionals. I cannot stress this point enough. We must follow the advice of our public health professionals. Learn about COVID-19 symptoms at algomapublichealth.com/COVID-19. If you do not have COVID-19 symptoms, avoid large gatherings or social events. As you carry out your daily activities, practice social distancing. Avoid close contact with people outside of your immediate family. If you believe you have been in contact with someone who has COVID-19 symptoms, self-monitor for 14 days. Track how you feel, track your symptoms, and take your temperature. This will be valuable information if you do need to seek care. If you are over 70 or immunocompromised or have traveled outside of Canada in the last 14 days, you should self-isolate for 14 days. I note, importantly, that we expect a large influx of Suites back from vacation and the United States over the next few days and weeks. All of those people need to self-isolate. And if you have family members or friends in that group, you need to encourage them to self-isolate. If you feel you have COVID-19 symptoms, you should self-isolate. If you are self-isolating, you should seek clinical assessment over the phone through Telehealth Ontario or by calling your primary care provider. All of this information is available to you at canada.ca/COVID-19, ontario.ca/COVID-19, algomapublichealth.com/COVID-19, and sault-ste-marie.ca/COVID-19. I want to end by recognizing that we are fortunate to live in a caring community. And many people, whether it be in a professional or personal capacity, are doing what they can to help others. This is critically important. Many people who are at the greatest risk have less social support, may be disadvantaged, elderly, or less mobile. While we look out and care for the needs of those closest to us, we need to be mindful of others who may not be as fortunate. Help where you can. This is undoubtedly a serious and challenging situation, but I am categorically confident that we have the collective ability as a community to meet it, rise above it, and move past it. We will continue to work together, and by doing so, we will manage through this challenge together. Thank you. Merci. Miigwech.
So thank you, everyone. That's the formal part of our presentation. We're going to open it up to questions from the media who are in attendance, and then we're going to jump to our phone line that have media representatives across Algoma as well. So
Then we can do one-on-ones after.
yeah, we can look at doing it one-on-ones after, yeah.
So I'll leave that then.
Does anyone have any questions?
Dr. Liu, can you tell us a little bit more about the person who has been confirmed positive? I noticed the press release says Algoma resident. Is that a Sault Ste. Marie proper resident, or is it, can you identify where in the Algoma district?
So I will say at this time that this is an Algoma resident. We're very mindful that there are a large number of communities within Algoma. Some of them are very small. The important thing to know is that as soon as this person crossed over into Canada, they took all proper precautions. They did not expose any member of the public, and they contacted public health when they experienced symptoms, so that they were transported to hospital and back home again with all appropriate precautions. So it doesn't matter if it occurred in the community where you lived or in another Algoma community. What this means is that we should now really start practicing social distancing measures.
So your press release confirming that has been out for about 12 hours now. Have Algoma Public Health lines or Sioux Area Hospital lines been inundated with calls from people that are concerned that they may have come in contact with this individual, whether it be on the plane, at the airport, or in a community?
So we actually have been receiving over 200 calls a day for the last over a week now. And this is something that we've been preparing for. We have not seen an increasing surge necessarily in that volume of calls, but what we have done here is expanded the phone lines. We've had additional nurses on those lines to answer folks' questions. We want to remind people that the number there to call is really for those who are experiencing symptoms and who have traveled. We have an email address, healthyworkplaces@algomapublichealth.com, for organizations who have questions for us about measures they can take at workplaces. So please, if you have general questions, please go to that email address and reserve the line for people who are feeling ill and need to speak with us.
Was she flying alone or with family and friends?
At this point in time, this is the only individual that we are concerned about, and any close contacts have already been identified and provided with public health guidance.
Male or female and elderly?
So this is a woman in her 50s.
When was the first test done in Algoma for COVID-19?
Oh, this is a good question. The days are merging very fast and furious. I would say that it was done within the past 2 weeks. On our website, you will find that there is a table of the number of tests that have been done, the number of pending, the number of positives, and the number of negatives. So I encourage you to check that website frequently if you want updates.
Yes.
Certainly, the mayor has noted that there will be an influx of travelers returning from March break trips and whatnot at our own airport in the States. Is Algoma Public Health going to be at the airport meeting those individuals that are coming back into Canada? And if so, what will he be doing there?
So at this time, we've established a great working relationship with those the airport as well as the land border. The land border officials have guidance from Public Health Agency of Canada and fact sheets with instructions that they are distributing to travelers coming back to Canada. And we, as of a few days ago, sent a large volume of signs, posters, and fact sheets for people at Sault Ste. Marie Airport to distribute to returning travelers.
It says you guys have done 62 tests. Where are those predominantly taking place?
The tests at this point in time are predominantly taking place at our local hospitals. As changes to testing and as additional supplies become available over the coming weeks, there are also some primary care settings where testing is taking place. Some of this information will be on our website as well.
Does that individual live with anyone else?
At this point in time, what I can share is that all close contacts of this individual have been notified and they are taking appropriate precautions. They're recovering at home.
So we're going to move to the teleconference line now. Is anybody in Wawa have a question? So Daniel, do you have a question for Dr. Liu or the mayor of the city?
Well, given the smaller hospital that we do have and the fewer number of people in this area, are there particular ways that people should be trying to seek medical attention at this point, or in order to get a hold of APH? I know I've had complaints from some people that they haven't been able to reach that health unit.
Thank you very much for that question. So the question pertained to our smaller communities and smaller hospitals. So absolutely, residents in those communities who experience symptoms, who have had a travel history, should call ahead, whether that's their local health provider or Algoma Public Health. They should be able to reach us, and we will give them guidance as to whether or not they should stay home and self-isolate and whether they need testing. Just as with this particular individual, Algoma Public Health really works with local hospitals to facilitate testing. So we work with the individual and we work with the hospital to find a good time for them to go to that hospital under all necessary precautions so that they can receive the assessment needed and then head straight back home.
Is there any follow-up to that question, Daniel?
No, thank you.
Okay. We'll move to Elliott Lake. Anyone in Elliott Lake have a question?
Yes, my name's Kevin McShevy with Standard. What's the average running time for the virus? Like, if somebody has it, how long would they be contagious?
So at this point in time, you'll be very familiar with the 14-day period that we are asking people to self-quarantine when they come back home. This is a wide period of time during which we expect that if an individual truly got infected with the virus, they would show symptoms within that period of time. If they do not show symptoms within that 14-day period, then it is very unlikely that they would have been infected, and they can carry on back to their social distancing measures and carry on those routine activities.
Yeah, but if they were infected, how long would they be infectious?
So if a person is infected and is showing symptoms like coughing or sneezing, they are infectious for as long as they are exhibiting those symptoms, because when you cough and sneeze, you are transmitting droplets. So for this reason, whether it's for COVID-19 or for cold and flu symptoms, we're telling everyone that if you have any symptoms at all, please do stay home.
Okay.
Any follow-up question, Kevin?
Excuse me, by not saying where this woman lives, we're not her address, but the community, so it's safe to say that she could be anywhere in Algoma?
So she is right now resting at home and recovering in Algoma.
Okay.
So we're going to move to CBC or Radio Canada. Are there any questions from you?
Hi, bienvenue Senga from Radio Canada. My question is, why are you specifically warning those who were on the outgoing flight to the US and not those who were on the incoming flight with the person?
Apologies if that was unclear in our media release. This individual flew into the Chippewa International Airport, the Chippewa County International Airport, and then continued by vehicle across the border at Sault Ste. Marie.
Okay, sounds good. Thank you.
Anything from CBC Sudbury?
Oui, Caroline Bourdua from Radio-Canada. Sault Hospital had talked about a case of healthcare worker being in contact with patient and physician and staff at the beginning of the week. Do you have the results of the test, if any tests have been done with that healthcare worker?
So at this point in time, we cannot comment on the test results for specific individuals, but I will note that there are no other positive cases at this point in time.
So he did test negative?
There are no other positive cases at this point in time.
Thank you.
And we'll move to Sault Ste. Marie. Rogers Radio's on. John, do you have any questions?
Yes, Leo. I guess just in terms, I mean, this is complicated in terms of you're talking about a flight. What was the, I guess, the process following this person coming forward that was on that flight with symptoms? Was there a process to track where the other, I mean, I wonder how many Sault, Ontario people were on that flight, or people from the Algoma area, and what other steps were taken in terms of advising maybe those people that someone on board was being tested and now has been confirmed as the first case?
Thank you for that question, and we have a great working relationship with colleagues in Chippewa County in terms of their public health officials, so we've already notified them of this occurrence, and with this media release, we are getting the word out to Algoma residents who may have been on that flight they should already be self-isolating, but if they develop symptoms or they have any concerns whatsoever, they can give us a call. They can give Algoma Public Health a call.
I guess we can assume then that nobody else from that flight has come forward with symptoms?
At this point in time, I can't comment on particular individuals, but our nurses are manning the lines as we speak, and they're answering questions and helping guide individuals on further actions, whether they were on this flight or whether they're any returning traveler with symptoms.
And I guess when this person was traveling back to Sault, Ontario, were they traveling alone?
They were in a vehicle.
I guess alone, or...
So any other close contacts have already been notified.
Is there anyone on the line that I missed that has a question? Okay, so thank you, everyone. We'll move to maybe one-on-ones in the room. And thank you, everyone on the line. We're going to hang up now.
Thank you.
Okay.
Bye now.
Bye.
Thank you.
Jennifer, can I grab you?
Sure, I'm just going to grab a quick draft of water.
Christian, I'll start with you.
Yeah, sure.
A minute. So, are you concerned at all that this is going to create a state of panic?
That was a joint press conference from the City of Sault Ste. Marie in partnership with Algoma Public Health. We will now go live to our news.